Hello, and welcome to today's Lunch and Learn, Understanding Radiation Oncology, a community guide to cancer treatment. I'm Tiffany Mason, NKC Health Cancer Center Executive. Thank you for joining us. Today we are going to discuss how radiation treatment has changed over time and the different types of treatment. We'll also cover what patients might experience during treatment, benefits, and the latest advances. Our speaker today is Dr. John Park, a radiation oncologist with NKC Health Radiation Oncology. Dr. Park is board certified in radiation oncology. He earned his medical degree and completed his residency with the University of Kansas School of Medicine. As a physician with the Veterans Administration, Dr. Park was the first author on guidelines for quality measures that were adopted nationwide. He has been instrumental in reestablishing NKC Health's independent cancer program and growing it significantly in just 1 year. If you have any questions during the presentation, please submit them using the Q&A feature below. We will respond to them at the end of today's discussion. And now, please join me in welcoming Dr. Park.
Hello. Thank you for coming today for this presentation on radiation oncology. Again, I'm Dr. John Park, radiation oncologist, and also medical director of radiation oncology here at NKC Health. So let's just get into it. What is a radiation oncologist? Well, as you know, oncologists, they're doctors who treat cancer. And there's three types of oncologists. There's medical oncologists who give medicine for cancer, typically chemotherapy. And there's surgical oncologists who do surgery for cancer. And then there's me, the third arm. We're the most unknown arm, but we are radiation oncologists because we treat cancer with radiation. Now, I would say about 90% of the time when people hear radiation oncology, they hear radiology. Now, we have radiology colleagues who diagnose treatments with biopsies, and they do all the scans, and they're an integral part of the cancer team. However, I'm a radiation oncologist on the treatment side of things. So what is radiation? Many of you are familiar with this electromagnetic spectrum. And in the middle there, you'll see the Roy G. Biv, the visible light we see. Radiation is on the way end on the high energy spectrum. So if you use your finger and you can show a slow wave, very easy to do. But if you start waving it really fast, it becomes harder because it takes more energy. So radiation is this high dose, high energy EM spectrum, and that's the stuff we use to kill cancer. Now, how does radiation kill cancer? Well, basically, it damages the DNA of cancer cells, directly or indirectly. So it directly might cause cell death, but more often than not, as the cells divide, the daughter cells of the cancer cells have the damaged DNA, and so they don't function well, and so they die, and on and on and on. So hopefully getting rid of all the cancer from this outside source of radiation. And where did it all start? Well, it started in the late 1800s with Wilhelm Conrad von Röntgen. Okay, and you see here a very famous picture of his wife's hand. You can even see the wedding ring on there. That was taken in 1895. And around the same time, Marie Curie, she, as we all know, helped figure out what all radiation is about. She even coined the term radioactivity. And she wrote a very influential paper in 1898 called On a New Strongly Radioactive Substance Contained in Pitchblende. And so the first radiation treatments actually happened in the late 1800s. In 1896, Victor Depigny publishes the use of radiation to treat stomach cancer. The year after that, Leopold Freund reports treatment of nevus pigmentosus with radiation. And that's basically a big mole, so it wasn't even cancer. In 1903 and 1904, physicians start using radium-226 to treat skin and uterine cancers. And in 1922, the International Congress of Oncology in Paris presents evidence supporting radiation treatment for laryngeal cancer. And that's one of the hallmark cancers that we continue to treat today. And so there's basically two ways to deliver radiation. From the outside, which we call external beam radiation, which you can see on the left there, and then internal radiation, which we call brachytherapy, brachy meaning short in Greek, where we actually take radioactive sources and put it inside the patient. 99% of radiation treatments is the external beam form, so that's what we're going to focus on today. There are other types of radiation treatment, like radioactive iodine therapy for thyroid cancer, and there's injections for prostate cancer, but that is done a lot by our nuclear medicine colleagues and won't be covered today. So what are the main benefits of radiation therapy? The first one is organ preservation, meaning you don't have to take out an organ in your body. The prototype for this is breast cancer. So many women have the choice between removing the breast with a mastectomy or taking a lump out, preserving the breast, and then treating it with radiation afterwards. What's important to know is that the cancer outcomes are not different with either option, so it gives women a choice to preserve their breast. As we kind of discussed before, voice preservation for laryngeal cancer patients is a major thing for radiation. So people are able to keep their voice box, have their natural speech, instead of having to take it out with surgery. Also for sphincter preservation, so our patients with anal cancer or rectal cancer, they're able to live without an ostomy if they use radiation, case by case, and also for bladder preservation, so people also don't have an ostomy. And again, that one's case by case as well. The other thing radiation does is eradicates microscopic disease. So you can imagine, let's say, surgery in the brain. You can't keep cutting and cutting and cutting. And actually in any area of the body, if you take out everything, what you can see with your eye on scans and even under the microscope may not be all the cancer there is. It's very small, tricky stuff. So we know that even though we can't see anything in there, there's still disease left. And so radiation gets rid of that microscopic disease. Also, it works together with chemotherapy in the fact that surgery and radiation are local modalities. What that means is it treats the cancer basically we see and we have a target. Chemotherapy kind of goes around your body, and if there's a little cancer that has traveled in the blood and went somewhere, chemo can go and grab that, which is, that's why we use both together. In addition, chemotherapy can help radiation work better locally. So we all work together. Now, side effects of radiation. Side effects of radiation are a little bit trickier to talk about because it really depends on where you're treated. So if you get treated to the stomach, and you might experience nausea, whereas you probably shouldn't experience dry mouth if you're getting treated to the stomach. So it really depends on the site you get treated with. A lot of people ask me, will I get burns on my skin? Typically, burns on the skin only come if the skin is in the target, such as in breast cancers or throat cancers. However, most people do experience maybe some fatigue of some kind and mild skin reactions. So for instance, if you have a lung cancer deep within the lung, a lot of times you actually get no skin reaction. But if you do, it'll just be mild since the tumor is deep within the body. Now, a lot of people do ask, does radiation give superpowers? Because technically, Bruce Banner did receive this gamma rays, which we sometimes use, but no, you do not get any superpowers from the radiation therapy. Okay, let's move on to the actual treatment. What do? Well, you'll first come see me and get a consultation, and then we'll schedule what we call a CT simulation. It's a CT scan, except it's synced with our radiation machine. And as you can see on the slide here, we outlined the heart, the lungs, the spinal cord, and for lung cancer especially, your cancer will move as you breathe. So we also capture that motion because we want to make sure we grab the target as it's moving. And as we draw on each of these slides, we create a 3D model, which you can see here with skin rendering and everything. And you can see that yellow rectangle, that is a radiation beam going around the tumor and trying to avoid everything else. And this is an actual picture of a radiation machine. On the left, you see there's a table, it's open, and it goes around the body. And before it comes out of the head of the machine, it goes through these, what we call multi-leaf collimators. And these leaves come in and out during the treatment, and they really help block normal organs, let's say the heart, if you have a lung cancer, and keep it open around the tumor. And so I always get this question. People always ask about CyberKnife and Gamma Knife. And if you can see here, these are just types of radiation machines. These are brand names. They sound really nice, but they're all the same external beam radiation. There's no actual knife involved. So this picture is of an actual radiation plan. And what I want you to focus on is on the red and white lines. The red line is 100%, and the white line is 50% of the dose we want to give. And you can see that it's really scrunched in. In the old days, radiation, we used to only be able to give 4 fields, like this way, and then this way. But now we're able to go in an arc. You saw the leads come in and out. We're able to take a CT scan, what we call a cone beam CT, every day to make sure everyone's lined up. This allows us to be as precise as possible. And then after about a week or 2, we get this graph. What is this graph? On the bottom is dose, and on the y-axis is volume. And long story short, we want the tumor to be getting 100% of the dose, and all the normal organs to be getting as little as possible. And you can see here that pink line, that's the heart. And the reason we create those 3D models is to get this graph, which we call a dose volume histogram. And it tells us how much dose is going where. And so I'll say sometimes, you know what, the lung is getting a little too much, let's do another plan. And then we'll say, oh, the tumor's not getting enough, and I'll go back and forth with my physics team to finally get the perfect plan. This is a picture of a laryngeal cancer plan. And there's a lot more structures to draw on for head and neck cancers. And we have great technology here that we have basically a checklist of how much a tumor should get, what's the minimum dose, what's the max dose, and various different what we call constraints. And we have these green check marks, sometimes we see an X, and we'll go back and make sure each of our patients gets the best plan possible. And then, after we do this, how do you know the plan we planned on the computer is the plan you're actually going to get? Well, then we actually have a physicist here who has a radiation detector. They'll take the radiation detector, zap it, and make sure that it's within, let's say, 5% of what I wanted, and say, great, go. So it is a very long process, okay? So what's the actual treatment experience like? Well, the treatments can be up to 35 treatments, and these take place Monday through Friday. Each appointment is approximately 15 minutes, and many of our patients also take chemotherapy concurrently, and that's usually given on a Monday or Tuesday. The chemotherapy is several hours, and so you may not have the same time on that day, but typically you have the same time every day. And every week you'll meet with me on an on-treatment visit just to make sure everything's going okay. And like I said, this takes a huge effort. This is my team. I could not do what I do without them. And we have nurses and then radiation therapists. The radiation therapists are the ones who actually deliver the radiation and meet with the patients daily. Again, we have physicists to make sure the plans are accurate and the machine is working. We have dosimetrists. They're the people who actually make the plan. We have administrators from the front desk. They handle all the insurance questions. And in back, where they order all the supplies to make sure everything is running. We have social workers. A lot of times people can't afford things like transportation, or they have to buy Boost because they're unable to swallow, and they help out with that. We have dietitians. Some of our patients have like feeding tubes, and they have difficulty swallowing, getting all their calories in, so they play a very important part. And also we have physical therapists, occupational therapists, speech therapists, speech pathologists that help the patient through the process and afterwards as well for rehab. So it requires a huge team. So I want to talk briefly about advances in radiation oncology. So radiation oncology is a unique field because as technology advances, radiation oncology advances. So you can see on the left on the slide where it says whole brain. So before, let's say, MRIs were around, before fancy radiation machines, you couldn't pinpoint the tumor, so you'd have to treat the whole brain. And as technology evolved, we were able to kind of cone down our treatments and treat just one area of the brain. And now, as technology has advanced even more, you see the stereotactic radiosurgery there, we're able to even hone in even more. And as technology keeps going, I suspect radiation will become more accurate. And on the right, this is from a paper I wrote, just to show that we can also do this really tight treatments in the lung, and we typically do this stereotactic treatment, brain, lung, liver, and the prostate. And the big thing here is obviously AI, and these pictures are AI generated that I created for a presentation I had at the research meeting at SWOG. SWOG is a national research group for cancer. And an exciting thing is multimodal AI. And what is that? So right now I'm partnering with Professor Yu-Young Lee's group at the University of Missouri, Kansas City, where we're trying to get AI personalized medicine. So they have a technology right now that is able to read the CT scans, automatically draw the tumors, and give things such as volume and where they're at. You can also look at the pathology slides. So right now, all the slides that you may think about from a long time ago, people looking under a microscope, but it's all digitized. So that we have algorithms that can read those slides. And then finally, the EMR, which is the electronic medical record, can read the text data from your chart, so like your weight, what kind of name of the chemo you might be getting, et cetera, to integrate all that data to get AI personalized medicine. And you remember in the beginning of our talk, we talked about how they treated a mole, essentially. And so we do treat occasionally things that are not cancer. The one we treat the most right now is called heterotopic ossification. So when you have a large hip surgery, sometimes the cells that create bones, get spread out. And if they grow enough, they can actually lock your hip in place with new bone. So we treat those cells before they can start the bone forming process. So right now, one thing that some people are starting to treat, including my partner here, Dr. Mallory, is osteoarthritis. Another exciting thing that I've talked about with our cardiology team is radiation to the heart. So for certain abnormal heart rhythms, when everything else kind of fails, we have this option to do radiation therapy to the heart, which is really exciting. And so a lot of things coming up as technology advances. Again, we will advance, and there doesn't seem to be a time when technology doesn't advance. So I appreciate your time here, and I'm ready to take any questions you may have.
Thank you so much for sharing that information. The AI piece is so intriguing to me. I can't wait to see the advances that come. I think we do have time for a few questions that came in. So the first one would be, what do you feel like is the most important lesson that you've learned in the past year with NKC Health Radiation Oncology?
Yeah, so I was at one place for 10 years, and I think it's not a new lesson I learned, but to learn that teamwork really matters. From the front desk, again, to behind the scenes, I've learned over the years that I cannot do it all, and I really need to depend on my team, and we have a great team here at NKC Health.
I would agree with that very much so. Next question. You've been active in the leading edge of radiation therapy research. What recent advances excite you the most?
Yeah, so it really is this AI piece. Right now, we do have a program that can automatically draw normal structure. So like the jaw, it's white on a CT scan, pretty easy. The heart, fairly easy to draw. So that saves a lot of time. What I'm excited about is that when it's fully automated from the very beginning, because that's going to open up a lot of doors that we don't know about. And so that's what I'm really excited about, and to see how that's going to change everything.
Definitely. So you mentioned that the AI can help you save time.
Yes.
What's the typical time that you spend now in developing those plans for a patient?
Yeah, so I would say if you do it the old way, we can cut our time by 50%.
Wow.
Okay, so there are certain things where you have to go back and forth, back and forth, back and forth. Sometimes you have to measure the volume of the tumor, and then the volume of the radiation dose.
Mm-hmm.
And if you tweak it a little, you have to recalculate it.
Right.
So if something is able to automatically recalculate it, then that saves tons of time. Also, I talked about our dosimetrist who creates the radiation plans, and often they help draw all the normal structures, drawing the lung, drawing the heart, but if that's all taken care of, we can see more patients, because that's not hard to do, but it's just time consuming. So,
Absolutely.
So the treatment planning part of it really saves a lot of time.
Very good. I think we have time for one or two more questions. What support services are available for patients navigating the diagnosis or the treatment process?
Yes, so I did talk about it. We have a whole team for that, starting from social workers. If you have trouble with transportation or any financial needs, we have a whole team for that. We have physical therapists and occupational therapists. Obviously, there's cancer fatigue and just side effects from the treatment, and they can help from beginning to end, and especially probably towards the end of it when patients don't have to come for chemo and radiation every day. We have that. We also have a dietitian that comes to our clinic weekly and talks to them, and then again, we mentioned a speech pathology team. For certain cancers, especially like the voice box and the head and neck, we like to do swallow studies before and after, and not only that, they help rehab that. So, yeah, they play a very incredible, important part.
Lots of good services available. Very good. Last question. What are some common misconceptions about radiation therapy treatment?
Yeah, so a common misconception is that you'll get burnt and you'll lose your hair. Okay, so if you're treating prostate cancer, you're really not going to lose your hair or get burnt on the skin. So I think that's one common misconception is you may have seen a breast cancer patient, but then if you have prostate cancer, you're not going to have the same symptoms.
Very good. Thank you again, Dr. Park.
No problem. My pleasure.
Appreciate your time. Our next Lunch and Learn will be hyperbaric oxygen therapy, a breath of fresh air for health, on Wednesday, September 17th, with Dr. James Maturo, an internist with NKC Health Wound Care. We hope today's presentation was informative and helpful. And once again, thank you so much for joining us. Have a great afternoon.